Good afternoon, everybody. This is Jenny from 3Spirit here, introducing Caroline, who has got a specialism in dementia and is going to talk to us this afternoon as one of our free podcasts around how we can support the dementia community at this time. Caroline, would you introduce yourself?
Hi, most people know me in 3Spirit. So my name's Caroline Bartle and I've been around quite some while, although these podcasts are quite new for us. So the situation is as it is, and we're trying to create new ways of communicating. But I've been working in the dementia field for almost 30 years now, a very long time. And I've got a real interest in the subject. And obviously the dementia community are going to be significantly impacted, as is the broader community. So hopefully we're going to be looking at some of the things that you can do to make life a bit better during this time.
Wonderful, Caroline. Caroline, I've got a couple of specific questions I'd like to put to you this afternoon. And the first one I'd really like to explore is, have we seen anything like this before?
Do you know, that's a really good question, and there was a great document that was produced last year by the Alzheimer's Disease International. It was called Forgotten in Crisis, and it was all about people with dementia and what they experienced in humanitarian crisis. And it's an interesting and relevant read right now. And, you know, the key messages actually from it is that people living with dementia have very unique and specific challenges in these circumstances. And particularly challenging is that people's ability to recover from change. And some of the things that we can sort of take away from this piece of work is that, you know, the outcomes are limited and around people's attitudinal barriers. You know, the way our attitudes to, we've got lots of negative attitudes towards age, and they will be very rife in this Covid-19 situation. But what's really important is preparedness, and actually thinking about our services. How can we prepare for the fact that actually many people are not going to have so much social contact? The other thing that springs to mind in this situation is when I was training in New Zealand, I heard a lovely story of when there was an earthquake in Christchurch, and the care and support staff were telling me that for a period of time one of the care homes didn't have any access to it, and the staff were understandably very frightened, but they got a lot of comfort actually from the residents. And the residents, having been through a situation like this before, were able to provide support. And I think that we often think about working with people with dementia as us having a one-way process of support, but actually we should be giving people the opportunity to draw on their own strengths. Many people living with dementia will have experienced the war and have developed capacities for resilience themselves. I really like the work that's the appreciative inquiry work that's done that comes from fields of positive psychology and storytelling, where we're able to really talk to people about their experiences. However, we do need to be mindful that sometimes situations like this can cause distress, and it can raise distressing memories. So, but we do need to consider, you know, when we're saying, has this happened before? You know, have people not felt safe before? Have people felt displaced before? All of those things happen frequently to people living with dementia. And so a lot of what we're going to be talking about now actually is just really around applying best practice principles. These are the kinds of things that people experience in terms of changing environments and changing situations that they don't know of, and they can't draw on a good memory store for.
Thank you, Caroline. That was really interesting to listen to that. So on the back of that, what do you think the biggest challenges are that's created by this situation?
I think some of the key things that we need to consider are supporting people's mental health, because obviously there is a focus on physical safety and there are broader issues around that. But the very fact that people are going to have reduced social contact is going to have a big impact on people's well-being. And we need to consider that actually that may have a detrimental impact in the longer term. People may not have the ability to deal with strong emotions because we use our cognitive ability to reflect and understand why we're feeling in a certain way. The other factors to consider obviously are connection and communication, and touch, which we use essentially when we're caring for people with dementia, may be impacted. So it's looking at other ways that we can have a connection or enable connection with people. Somebody living with dementia is likely to be able to sense your tone in ways and be able to feel a connection without touch, and it's how we can tap into those gifts with somebody. It may be difficult to communicate what's happening to somebody if they perhaps don't understand the situation, and some of the topics that you touched on, Jenny, in your podcast around making sure that we've got information that's accessible. Sometimes it may be appropriate to minimise distress, where we should always tell the truth. Maybe telling the truth isn't always appropriate, and I would urge people to consider the guidance created by the Mental Health Foundation, the Truth Lies axis, where we would look on a continuum as to where would be an appropriate strategy to respond to somebody that perhaps doesn't understand what's going on. For example, somebody may not understand why people have got face masks on. So thinking creatively how we can enable connection in people and how we can communicate what's happening. One of the lovely things about music is that it's a great way for people to remember things. So jingles to help people remember to wash their hands actually work really well for somebody living with dementia. And, you know, when we think about connection, we need to think about connection quite broadly when we're working with dementia. It isn't just about connection with people, it's also about enabling connection with the environment and connection with a person's identity. And there are all kinds of strategies that we can use to enable that. For example, familiar routines as far as possible will help somebody to have a connection to their own identity, having environments that are familiar. In terms of connection to the environment, consider the sensory needs of somebody. You know, there will be people potentially that are left at home for longer periods of time. And, you know, we need to think about what can we do when we leave people to ensure that the lighting is appropriate, that things are accessible to people, that people feel a sense of security in their environment. We need to also make sure that they're, you know, in terms of connection, that their people are able to connect to family through the use of technology. And using technologies can be problematic for people with dementia because of the challenges in learning new technologies. And where it's failed potentially in the past is that people haven't spent the time really to work with somebody, or haven't considered how some of their comorbidities might impact on the way the person utilises that technology. For example, people that have motor skill difficulties or people that have sensory problems. But nowadays, you can get aids and adaptations like screen readers, magnifiers to help people use technology. It can be difficult for people to sense make certain technologies, and I think it's good to have a period of observation to see how people get on with particular technologies. We also need to think at a time like this, the challenges that people have living with comorbidity and dementia. We know that people with dementia are at high risk of developing COVID-19. And it's important that we mitigate the risks by managing some of those other conditions that people live with. And the challenge that we've got is that a lot of people's symptoms may present differently, and people might have specific challenges communicating their physical challenges. So, for example, if somebody is in pain, you know, asking somebody if they're in pain, a person may find difficult to understand because pain is quite a medicalized term. So words like sore or hurt. So the way we communicate with people will help us to identify. And delirium may be an issue right now, and thinking about what tools we can use as a service to help monitor delirium and catch it as early as possible. So we've got the stop and watch tool that we've advocated to use previously. There are quite significant gaps in knowledge around conditions that are common in dementia, because we know that 90% of people with dementia live with other conditions and painful conditions, depression. So we need to consider those things, and actually living with an illness and not being able to understand the length of that illness or what it means, and being able to recognize what pain is. People are likely to get agitated, and being agitated is going to cause challenges for a service, and we're going to deal with that in a separate podcast. But I think, you know, in what we need to consider is that there are lots of people out there that perhaps are living with dementia that are invisible, and actually being in a crisis situation right now, and they don't have people around them potentially to help them navigate through the situation. And, you know, sometimes we can have the pathology of dementia present in our bodies, but actually it takes a crisis event in our social lives, often loss, that can trigger it. So we need to think about the potential consequences of a massive social problem like this on the broader community that perhaps, you know, haven't yet been diagnosed. And I think, you know, we can all use this as a period of reflection, because we all will have, to some degree, our freedom minimized. And that is the experience for many people living now with dementia. Many people are living in situations that they don't want to be in places that they can't leave. So I think it's important that we take a moment to reflect actually how we can draw similarities between that experience and those people living with dementia.
Thank you, Caroline. That really important last point there about how we can actually learn from others and really improve our empathy. Wonderful. Thank you so much.